And when I first had to start Roaccutane because my acne got so bad, I remember quickly googling on YouTube what to expect with Roaccutane, and this came up and all these ladies were saying it's like a nose job, and I was so thrilled. I think it was in a way. I do notice that my tip is a lot like more refined. The mask we used during COVID did nothing to help my skin, and the more that I tried to cover it up with makeup, the worse it got. The day my skin was clear was the happiest day of my life, because I had tried everything from cutting out dairy to putting aspirin and toothpaste on my pimples to spending thousands on skincare and facials and peels, and I even just tried doing nothing because I saw all of this advice from YouTube and the internet. The longer that I had left it, the worse the scars were getting and the more severe my acne was. I eventually went to 2 different dermatologists, which was an entire process in itself, and then that process was taking oral antibiotics, taking topical retinoids and topical antibiotics, and eventually that led me to taking oral retinoid Roaccutane as we know it, and that fortunately has led to the remission of my acne for the past year. Touch wood, everything's going well, and this brought me to making this video today because I wish I'd watched one of these to begin with. Today I'm just going to be sharing my experience through the entire process, specifically my experience with the oral antibiotics Tetralysal, the topical retinoids and the topical antibiotics, as well as the oral retinoids. I'm also going to just be touching on the causes of acne, because if we don't treat what is causing it, even if we treat the acne, it's just going to persist. We will also be talking about common myths which could be making your acne worse, and any over-the-counter skincare products you might be using which could also be exacerbating your acne. I do suggest that you see a doctor, see a dermatologist. I am just going to be sharing my experience through the entire journey and my experience with the things that I was recommended. The causes of acne. Firstly, we are always taught in medical school, make sure that the acne is not hormonal. For women who are diagnosed with PCOS, polycystic ovarian syndrome, they will have symptoms such as irregular periods and acne and possible weight gain. That is something your doctor is going to want to eliminate, and if that may be the cause, they're probably going to try and put you on oral contraceptives. I won't be covering that in this video, but there are plenty of resources you can go and just check out. Genetics can also cause acne. Unfortunately, there's nothing you can do about that. It's just luck of the draw. Medications you're taking could also be causing the acne, such as mood stabilizers, or perhaps you recently had COVID and they gave you a course of oral prednisone, which is a steroid. That could be exacerbating any acne that you're experiencing. Do not stop any medications you're taking without the advice of your doctor. I'm just telling you what could be causing it. And most importantly, any contact items that perhaps are dirty, such as pillowcases you haven't washed in a while, headbands that are constantly on your forehead region, your cell phone that you're pressing against your cheek when you're calling your friends to gab about the day, and cosmetics that are not washed off properly. So always make sure to remove your makeup properly before you sleep, ladies. So the big dairy debate. We were taught that dairy does not cause acne. However, in researching in preparation for this video, I found a meta-analysis by Agassi et al., which was published in 2019. We are also taught in medicine, when you see the word meta-analysis, you trust that, because that is a ton of literature that is reviewed by these authors. What they found was there is no positive linear association with the intake of dairy and the occurrence of acne, right? But there was a positive linear association between the amount of dairy that was consumed and the occurrence of acne. If you do not take dairy, like if you do not have dairy, versus if you have a low dose of dairy, your occurrence of acne is not going to change that much. Whereas if you have a low dose of dairy, so just a bit of milk in your coffee in the morning and then that's kind of it, versus someone who drinks gallons and gallons of milk a day. I don't know why you would be doing that, but if you are doing that, there is a positive association with the person who's drinking gallons of milk and having acne. I specifically mentioned milk because in this study, they also found no association between other dairy products such as cheese and yogurt. So my personal opinion with the whole big dairy thing is I don't consume dairy, but that's for ethical reasons. If you are someone who does consume dairy, I recommend you keep taking it because you are going to get calcium and your vitamin D from that, and I don't want to be the reason anyone suffering from any nutritional deficiencies. Me not having dairy, I know how to compensate in my diet for that. It's interesting to note that cheese and yogurt both are good probiotic tools to have in your diet, right? And neither of those were related to acne, and there's more recent evidence certain strains of bacteria in the gut with people who experience acne. So moving on to our next myth, the myth of being dirty or having dirty skin. I know when I first started having acne, something all my relatives told me was, dude, just wash your face. No, don't wash your face like 7 times a day. In fact, the more that you're washing your face, you're stripping it off its natural oils, and that's going to cause your tiny poor pores to have to like, that was like a bit of alliteration, but produce more oil just to protect the barrier, and then all that oil production is going to actually exacerbate your acne. So you're not dirty, it's okay, don't overwash your face, don't do that. And lastly, stress. I hated being told, oh, you're stressing, that's why you've got acne, as if I can control my stress. Like, sometimes external things happen. Yes, I do agree, you do need to be mindful, try breathing techniques, do exercise and stuff, but sometimes, you know, like, it's such a arbitrary marker. Like, how do you quantitate your amount of stress? Stress is associated with the severity of the acne, but not necessarily the occurrence. So again, it's okay if you're stressed. It's probably going to stress you more. People tell you not to stress. Products, I know there is a lot of debate about this, but I have found that foamy skincare washes tend to also strip the skin of its protective barrier, so use those with caution. Perhaps not like twice a day every day, especially if you are going to be going to a dermatologist and you're going to be taking things like topical retinoids and topical antibiotics, which are already like drying your skin out to some extent. And using all these fancy peels that you just might find online, really great, but it has its place. And if you are in the middle of an active episode of acne that is quite severe, I do not recommend going and self-medicating in a way, so do see a doctor. When you do go to your doctor, they're going to probably prescribe a topical retinoid or a topical antibiotic first, right? That's first line therapy. Back when I first started having acne, they recommended something called clindoxyl gel. I'm including in the video because maybe somewhere internationally people are still using clindoxyl, although I know in South Africa it's completely sold out, and nowadays they prescribe Epiduo, which has a topical antibiotic and the topical retinoid in one product, so it becomes easier for the patient to use. Apparently it had exfoliative properties, so it like reduces the dark marks. The topical retinoid works in a similar fashion, except it's not an antibiotic. All that did was increase the skin cell turnover, and that also helped with scarring. Both of them are going to reduce your inflammation. So the topicals really work nicely. From my personal experience, they worked amazingly at first. You must remember, I've had acne over the course of many years, and unfortunately, most recently I have found them to be less effective. Next thing we're going to be talking about are the oral antibiotics. I was prescribed Tetralysal. It worked like a charm the first time. It's a 3-month course. It was 300 milligrams. Within a week or two, I think my acne was completely cleared. I was so happy. Unfortunately, a year later it came back. Then this is where the whole 2 dermatologist story came in. The first dermatologist told me to take it again, and I did, and again it went away for a year and it came back. I'm going to use this opportunity to talk about antibiotic stewardship and why it's not good to be taking antibiotics again and again, because it does build up resistance against the antibiotic. The strains of acne that you're going to have are going to be less responsive to these antibiotics, and not only does it affect you as an individual, it's going to affect entire society, because maybe in 20 years people are not going to be able to take Tetralysal 300 milligrams because it's just not going to be effective anymore. And not only to mention the fact that it's going to reduce its efficacy, every time you're taking an antibiotic, whether it's for a flu or acne or whatever, you're killing off your gut microbiome. It helps you with everything from your immune system to your cognitive function. It's even been linked to mental health and Parkinson's and Alzheimer's. So you want to preserve your gut microbiome as much as possible. If you are taking that, please make sure that you're having sauerkraut or kimchi or some type of fermented goodie. I mean, if you're into going and buying probiotics, do take that, but I'm personally against that. I prefer as natural as possible. I mean, most cultures, if you look at historically, they all have some type of fermented product that they all ingest. Our ancestors knew something maybe we didn't, and probiotics are basically absent except from yogurt, I suppose, in the Western diet. As you can see, our obesity rates are skyrocketing, mental health is so bad. The gut microbiome has even been linked to cancer. So protect your gut, try and stay away from antibiotics if you can. But of course, the therapeutic intervention is before people go on to oral Roaccutane, which is our next point. So oral retinoids, Roaccutane. I think Roaccutane is the brand name, Oratane is the generic. I was so scared of taking this. I had heard such terrible things. I think earlier on my channel I spoke about how scared I was and how I was so against it. And I was against it until I actually went on it. And I realized it was not that bad. And when I went on oral Roaccutane, within a week again, my acne went away. The prescription is 0.5 milligrams per kilogram. You're usually started off on 20 milligrams daily for the first month, and then they kind of build it up, right? I had a lot of nosebleeds towards the end of the first month, as everyone does. I also had dry lips, a bit of dry skin. It wasn't insane. I had such bad mood swings, but in retrospect, you know, there was a positive correlation between the amount of argument Shavara had and taking Roaccutane. But when it was going on, I was fighting with everyone in my life, and I didn't know why. Like, I genuinely thought I was right. And don't forget the sun sensitivity. Please wear a sunblock, and also you have to take oral contraceptives, or like you have to sign a waiver. You cannot fall pregnant because there will be fetal abnormalities. I went to see my dermatologist after the first month, and she advised me to take that dose, the 20 milligrams, 3 times a week for like 3 months, I think, and then 2 times a week for 2 months, and then for 1 month I only had to take it once a week, so I didn't have to worry too much. And then I didn't have to keep going back to check my liver function and stuff because it was on such a low dose. I do know a lot of my friends unfortunately have been put onto the 40 and the 60 milligram dosage. I'm sure, you know, the side effects are worse than what I experienced. You're gonna have to test your liver function and your blood glucose as well as lipid panel. So basically what the study found was very few people actually experienced like detrimental side effects where interventions were required. However, most people who do take it, there is some change. So you're gonna have a little bit of higher cholesterol than your mean average, but it's gonna still be within normal. As soon as you stop taking it, it's gonna return back to normal, so you're gonna be fine. And now for the part that everyone who starts Roaccutane wonders, is my acne gonna come back? So I did a bit of literature surfing, looking at all the journal articles that were published, and they found that this was associated with a good prognosis. Now remember, you don't need to be doing this for you to have a good prognosis. Like, I'm no longer on Roaccutane and I have not had a single pimple. You do have maybe very severe acne. Taking 120 milligram tablet once a month is good prognosis. And in addition to that, it was also associated with normal liver function. As a final thought, I wish I started Roaccutane sooner. It would have saved me a lot of heartache, a lot of money. Also would have reduced the amount of scars I had, because remember, the longer you have this inflammation on your skin, the worse your scarring is going to become. So you want to treat it as soon as possible. I wish I was not as scared of Roaccutane because of the controversy that you see in the media. And if you're going through experiencing acne, I do advise please see a doctor as soon as possible and discuss all the treatment options with him or her. If you do want to know more about gut health, which I'm very interested in, please let me know in the comments down below.